Davidson County is a large, fairly large metropolitan urban area, but unfortunately we have a disproportionate number of uninsured, low-income, and underinsured residents that live in our community. And in addition, over the last decade, we've had an influx of foreign-born citizens that have also moved in our community.
Nashville is so full of healthcare places, hospitals and healthcare companies, innovative little healthcare companies. Nashville is like a little medical mecca. So why shouldn't we be helping to take care of patients, as we're prospering?
There's 400,000 people who are uninsured in our state. 400,000 people who do not have health insurance. What about that mom of 4 who finds that lump in their breast? What is she going to do? What is she thinking? What are those children thinking? Or the father of 4 who's 40 years old that I saw just last week, who has a mass on their kidney the size of a softball. What is he going to do? What are we going to do?
I see a fair number of patients who come to Nashville. They may not have a job. Sometimes they have language barriers, and they need care, and they don't need it later. They need it now.
Well, back in 2000, we discovered that many of this population, they were using the hospital emergency departments as a source of primary care. At that time, the Consortium of Safety Net Providers formed, which would later become the Safety Net Consortium of Middle Tennessee.
The Middle Tennessee Consortium of Safety Net Providers, we still meet every month. We have met every month for years and years. And, it's just so great to see 20 to 25 and sometimes 30 people in a room that are there for the exact same purpose and the exact same reason, is to care for those who are uninsured, those who are vulnerable, and those who are struggling to find health care.
In February of 2002, they formed the Bridges to Care program, which is now called Project Access Nashville. The whole purpose of Project Access Nashville was to create a collaborative and a coordinated effort to make sure that people were adequately seeking and properly seeking primary care by linkage through a safety net clinic.
As we saw, we had an influx of uninsured patients. Now what are we going to do when they need specialty care? And thus Bridges to Care Plus was created. And that program has been a lifesaver to so many patients.
If they go to a clinic and is determined that there are some needs that exceed what the safety net clinic is able to provide, they can identify a specialist through the specialty network that is offered through the Nashville Academy of Medicine, Project Access Nashville Specialty Care.
With Project Access Nashville, we're able to offer patients the ability to see specialists. And when the primary care physician that is seeing them determines that they need specialty care, we have that opportunity to give them the very best care they need.
But once we determine what needs to be done, then we do need the assistance of the hospital to provide the operating room or to provide x-ray services, lab services, outside labs that work with providers to provide lab services. All of that works in concert to take care of a patient because one physician cannot do it by himself.
Project Access Nashville makes it very easy to help me take care of the patients I am seeing. They help with one phone call to coordinate all the hospital admission needs of the patient, to help with any additional specialty care that might be needed, to help further the care of the patient. And so it's very easy and very rewarding to work with Project Access Nashville.
We were able to have those relationships with our hospitals and our community that know that if these folks are uninsured and 200% of poverty, they're donating those services.
This program, Project Access Nashville, is so important because this program has already gone out and requested assistance from physicians, hospitals, other agencies to take care of a patient.
I'm very grateful to be involved with Project Access Nashville. It's so rewarding to see everybody coming together to help patients in need. The physicians, the hospitals, and all the other support structures in place that without question help these patients on a daily basis. It's very rewarding to be a part of that experience.
I can't say enough about the physicians. I can't say enough about our specialists. I can't say enough about our providers who day in and day out see these patients willingly, gratefully, and feel so rewarded and blessed after they see the patient.
Those patients are so appreciative. I mean, they're just so appreciative. And it's a great feeling to be just told thank you. I mean, just thank you, thank you. And that's wonderful. Or the hugs. I mean, that's even better, because the patients that give you hugs because you took care of them. I mean, I love that. And I mean, that makes me happy to know that I've been able to provide someone something that was so necessary, that they really needed.
Those patients, go away with hope. They go away with knowing that they have gotten the best care, that they've gotten the same kind of care that they would have gotten whether they had the best insurance or whether they had none. Because our physicians and our specialists are some of the best in the country.
Building on this rich tradition, both with Bridges to Care and Bridges to Care Plus, Project Access Nashville has continued to provide needed specialty care for patients and also primary care for many patients in the region.
Since the inception of the program, we have enrolled over 62,100 persons, as well as provided for 208 plus thousands of prescription medications to these patients. Additionally, we have provided over 8,000 transports to and from hospital visits for those who did not have transportation to their appointments.
Thank you to all of the physicians, clinics, hospitals, labs that have participated in this program. 1,100 physicians alone have participated, have donated services. 6 hospitals in Nashville have donated services. And we can't take care of these patients without all of you. So thank you so much, and please continue to work with this program.
Through Project Access, we have connected over 62,000 people have been connected to medical homes. They've gotten care when they perhaps would have never received care. And then the donated services by physicians, the specialty care, nearly $33 million has been donated services from specialty care. That's incredible. That's incredible, the hearts of these physicians and the hearts of these specialists.
I mean, that's a huge impact. And I think that as a city, Nashville should be very proud that it has an organization that can make that statement. And I think it's great that Nashville can say, yeah, we're taking care of patients, and look what we have. Look at this little gold nugget that we have.
Project Access is the answer. There's never a time that's more needed now than ever, 15 years later, that this consortium is needed to keep on, to keep moving forward, and to include others. Well, we as a community have to pull together, and we as a community have to serve those who are the least of these, those who are poor and vulnerable among us. We cannot turn our backs. We cannot shut our doors. We cannot pull our blinds. We have to serve, and that's what we're called to do, and we will continue to do that.